We'll have a ball drop. Oh, that means it's go time. All right. Hi, everybody. I'm Natalie Rubio. I'm an occupational therapist here at LVE. I do the pelvic floor therapy, amongst many, many other things, but we are here today to talk about pelvic health. So welcome to this month's Fitness Rehab Education Series, Life Without Leaks. Thanks for coming to learn about incontinence and our pelvic health program here at LVE. Incontinence can drastically change your life. If you have it, you know exactly what I mean. It's one of the most underreported conditions, along with cognition, for which individuals are willing to share and seek treatment. Has incontinence changed your life in any of the following ways? Has it limited your social activities? Are you missing or avoiding important appointments? Are you avoiding travel or visiting family? Are you getting up multiple times at night and not getting good sleep? Are you afraid or embarrassed to talk about it with your doctor? Feeling there's nothing you can do about it? Have you changed your drinking and or eating habits due to fear of needing to go to the bathroom at an inappropriate time? Physical or occupational therapy can help, and many of the continence issues can be improved or even resolved at any age.
I've learned about every restroom in Gainesville.
Well, you're in the right place.
I've got the app, somebody told me about.
There's a Where's the Bathroom app?
There's a flush, it's called Flush, just look at, and when you hit it, wherever you are, it'll tell what the nearest bathroom is.
Oh my, no. Don't share that app. That means people are gonna get used to that being the norm. You come see me. All right, so the objectives for this presentation are to appreciate the impact of urinary incontinence on quality of life and the costs associated, understanding normal bladder function, understanding the causes of urinary incontinence, to learn about the different types of urinary incontinence, and learn how bladder irritants might affect you, as well as learn how we and the rehab department can help you. Do you know how many people are impacted by incontinence? Anyone take a wild guess, percentage-wise? Oh, it says it there?
Yeah.
50%.
Okay, well, yeah, it does say it there. Over 33 million people suffer from urinary incontinence in the U.S. 15 to 30% are younger than 65, and 30 to 55% are 65 years and older. It's an estimated 1 in 14 men and 1 in 3 women experience incontinence. Annual cost is estimated to be around $65.9 billion. All right. Incontinence is often undertreated for the following reasons. People are embarrassed at sharing the issues. People don't speak to their provider about symptoms due to believing it is a normal part of aging. Healthcare providers and older adults may feel as though other health issues take a priority over incontinence, and there is often inadequate assessments in older adults. Unless doctors specialize in incontinence, it's often not a part of their assessment, so they don't ask about it. The only way to improve your continence is to share your concerns with healthcare providers. Our community nurse practitioners have been educated on our pelvic health program and have an assessment to share during your annual visits. As you get older, there are some things that do contribute to why you may start experiencing incontinence. Some examples of how aging may contribute to the prevalence of urinary incontinence are decreased activity, orthopedic conditions that affect mobility like osteoarthritis, decreased strength and endurance. However, something can be done. Although the prevalence of incontinence increases due to factors associated with aging, it does not necessarily mean it's normal. Just because something is common does not mean it's normal or inevitable, and it certainly does not mean that you have to live with it. Let's take a moment to learn a little bit about our urinary system. The human urinary system has 2 primary components, the bladder and the pelvic floor muscles. The bladder is like a holding tank that holds urine. The pelvic floor muscles work as outlet valves. Here's that plumbing you were taught. Everybody wanted to learn about plumbing. Here we go. Controlling the release of urine, hopefully at an appropriate time in an appropriate place. The bladder is made up of what we call smooth muscle. It contracts and relaxes based on messages it gets from the brain and the neurological system. The bladder is like a balloon. It relaxes and stretches to fill up with urine, then contracts to empty the bladder. The pelvic floor is a group of muscles at the base of the bladder that control what we call sphincters that act as valves. When the pelvic floor muscles are contracted or tight, the valve is closed and urine stays in the bladder. When the pelvic floor muscles relax, the valve opens and lets urine flow out. These muscles are also influenced by messages from the brain, but can also be controlled volitionally by you. You may have heard of Kegel exercises. These are exercises that involve actively contracting and relaxing your pelvic floor muscles. You have some control over your pelvic floor muscles. They are a category of muscles called skeletal muscles. You can contract and relax them just like other skeletal muscles, like your biceps, your triceps, your quads, and your thighs. And a lot of times, people solely focus on needing to contract and hold and hold and hold, when sometimes it might be the opposite. It's just as important to know how to relax a muscle as it is to contract a muscle. So helping with the coordination of those contract and relax is another big part of working on the pelvic floor. Here's a nice joke. Incontinence helpline, please hold.
That's my kind of humor.
There you go.
Can we get copies of those? I'd like to forward them.
That's right. All right, so here is the anatomy of the urinary system. Just a brief lesson to put it all together visually. Hopefully you can see that up there. Your kidneys at the top, those little red kidney bean looking things, filter your blood and produce urine. The urine then flows down to your bladder. Your bladder is a balloon-shaped organ that sits in the pelvis, expanding to hold your urine and contracting to release the urine. It's supported by the pelvic floor muscles that hold the bladder in place and control the sphincter muscles. The urethra is the tube that carries the urine from the bladder out of your body. Sphincter muscles, along with the pelvic floor, keep the urethra closed and hold the urine in your bladder until the brain sends your body the signal it's time to go. When these pelvic floor muscles are strong, the sphincters stay closed and no leakage of urine occurs. However, when these muscles are weak, you end up with leaky sphincters and urine can leak or spill out. Also, if messages from the bladder to the brain are impaired, the signals can miscommunicate the urge to go to the bathroom. All right, now let's talk a little bit about what normal bladder function is. Average bladder function. Your bladder should be able to hold approximately 1 1/3 cups of urine before having to empty it. You should be going to the bathroom 5 to 10 times in a 24-hour period. And for nighttime voiding, for people age 65 and older, getting up during the night to go to the bathroom on average is about 1 to 2 times. If you're not getting up at all, congratulations, great job, you're ahead of the game. But it is normal over the age of 65 to get up at least once a night, but no more than 2. Urgency is the feeling in your stomach that tells you to head to the bathroom immediately. Although you may feel an urge, a healthy adult should be able to hold off the urge to go to the bathroom for up to 30 minutes, giving you plenty of time to get there. If you can't suppress that urge for 30 minutes, then you have an urgency problem. When the bladder is functioning normally, you should get the first urge when your bladder is only partially full. It should not be an urgent urge. Urgency can be the result of bad habits over the years, like holding your urine for too long before emptying the bladder. Over time, we suspect signals to the brain and the overstretching of the bladder from disregard of the need to go changes the ability to hold urine, and also urgency signals are sent too late. So this is a visual of the bladder and signals that are going for the different types of incontinence. These are the most common types of incontinence: urge, overflow, and stress. Essentially, urge incontinence is a bladder problem. The signals to go are not functioning properly. You're getting inaccurate signals that you have to go too often. Stress incontinence are more related to the pelvic floor muscles and those sphincters, the pressure within the abdomen, and the bladder overpowering the strength of the pelvic floor muscles to keep them closed. And bladder and pelvic floor muscle problems can both contribute to overflow incontinence. Okay, a little bit more about urge incontinence. When you get the urge to go to the bathroom, but you can't make it there in time, that is called urge incontinence. It's a urine loss with an urgent need to go to the bathroom caused by involuntary bladder contractions. So experiencing a sudden urge to go to the bathroom when you put the key in the front door, hear running water, drink a small amount of fluid, trouble making it to the bathroom in time. These are all examples of urge incontinence. Stress incontinence. You may not experience incontinence every time you do one of these things, but any activity that increases the pressure in your abdomen can make you more vulnerable to unintentional urine loss, particularly when your bladder is full. This is called stress incontinence. It's when urine loss occurs during physical activity that increases the intra-abdominal pressure and the pelvic floor muscles are not strong enough to control the urine loss. So this is things like when you laugh or you sneeze, lifting up heavy objects, especially when you're not using proper body mechanics. We talk a lot about holding our breath. I see it time and time again, not just with my residents that I'm seeing for pelvic health, but I see it across everywhere from Willowbrook to somebody with a upper extremity injury, and they're doing exercise and they're just holding their breath. And all that's doing is holding all that air inside their abdomen, and all that air is putting pressure down into the pelvic floor. So it's not allowing the system to work properly, and it's pushing down, 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 which over time weakens your pelvic floor. So an example is if we tried coughing right now when your hand was in your stomach. So do just a forceful cough. You go, everybody do it. Put your hand on your stomach and cough, maybe cover your mouth. There you go. So most of you, I'm sure, felt your belly expand into your hand, right? So all that forceful air is in your abdomen, which is thus pushing down on your pelvic floor. And leakage could happen. So I hope nobody leaked right now. And if you did, come see me. We'll fix it. All right, overflow incontinence is another type of incontinence when the amount of urine produced is more than the bladder can hold, or the bladder never completely empties and a constant dribbling occurs. Are you volunteering? Like, yes, I understand. That's you. Yeah, you picked that one. I would say that that's probably fairly common with men, especially in this age range, who have had any prostate issues. That's one of the big factors for men. Everybody talks a lot about women because of childbearing and things like that. But with men, especially older men, that kind of turns out to be something that impacts the pelvic floor, is having any type of prostate issues. So that's where that comes in for the male population. Oh, good, another joke. This for you. Let's see if you like this one too. All right. This is mini pause. How am I supposed to take a 2-mile walk when I can't go 2 feet without having to go to the bathroom? So if you can relate to her, you got to come see me so we can get you walking and more active. All right, so this is the male and female anatomy of the pelvic floor muscles. Externally, obviously different, but the internal for the pelvic floor muscles and organs are all going to be essentially the same. So the pelvic floor muscles are at the base of your pelvic floor and form a hammock. So that little red hammock looking thing at the bottom, those are your pelvic floor muscles. Both men and women have pelvic floor muscles. And when they're relaxed, you should be able to urinate and defecate. When they're engaged or contracted, they stop the flow. These muscles are critical at keeping the lower urethral sphincters closed until it's time to void or have a bowel movement. If the pelvic floor muscles are weak, you may experience incontinence. The anatomy for both men and women is relatively similar, and thus incontinence issues and treatments are also very similar. The pelvic floor is the floor of our abdomen. Your diaphragm is the ceiling, and your core muscles are the walls. So anything that affects any part of the abdominal house is going to have an impact on your pelvic floor muscles. Things like posture, effective deep breathing patterns, strength and coordination of the diaphragm and abdominal muscles, strong and flexible hip and spinal muscles, strength and coordination of the pelvic floor muscles. So like I spoke to earlier, breathing is a big one. Not everybody will associate breathing with pelvic floor function, but it has everything to do with it. There is, believe it or not, a wrong way to breathe. I'm glad everyone is breathing because you're all sitting here, but there are better ways to breathe optimally, especially when you're active, moving around, picking up heavy items, exercising. There are optimal ways to breathe, and that will help function. This is a canister system that works efficiently when things are working together, meaning your breath work is a huge component of that, and the ability to activate your abdominal muscles. A lot of the muscles are those deep, you have layers of abdominal muscles, and those deep muscles that you can't really see or feel are the ones that we have to work really hard to activate and turn on properly. On the other side of things, sometimes they can be too tight and too strong. So there are dominant. You can be glute dominant. You'll see squeezing. I look for any squeezing of the glute muscles, which usually means you're carrying tension. Or if your stomach muscles are always contracted and you're kind of tense right there, that probably means that you're overly tense, and that can also put pressure on the pelvic floor. And it likely means that you are unable to relax, thus unable to fully empty your bladder. So that's why the assessment is so important for a therapist that's well versed in pelvic floor, because it's not a one size fits all. Okay. All right, keeping your pelvic floor functioning well by doing 4 things: working on your posture, doing Kegel exercises, and when I say Kegel, I don't just mean the contract part, I mean the relax part also. Doing core exercises and performing good deep diaphragmatic breathing. These will support your ability to be continent and get good quality sleep because you won't be getting up multiple times to go to the bathroom. If you're sexually active, it can help with sex, as the pelvic floor muscles play a role in arousal for both partners and will generally improve your quality of life. A well-functioning pelvic floor will significantly improve your continence, and in many cases, the typical issues that cause problems with the pelvic floor are reversible at any age. Getting into some lifestyle changes. Along with the strengthening, a lot is focused on lifestyle, what you're putting into your body, and these are some of the things that we work on. What we eat and drink impacts bladder functioning. This slide lists some possible irritants to the bladder, as well as alternatives that will not irritate the bladder. I know, I was like, it's small on my paper and it's small up there. Okay, so I'll read. So these are on the yellow side, drinks that can irritate the bladder. So caffeinated tea and coffee. So I will encourage, if you just like coffee and you've drank it forever, try a decaf or even a half calf, right? I sometimes will do a half calf just because I don't always like the way that I feel when I drink caffeine. So I'll do a half calf, half caffeinated, half decaf. Green tea, hot chocolate, because I hate to break it to any chocolate lovers, myself included, there's caffeine in chocolate. Fizzy drinks, especially cola, it's a double whammy because sodas are very fizzy and they're also full of sugar, and those are both no-nos. Caffeinated energy drinks, which I hope none of you are drinking, and then fresh acidic drinks, so orange juice, grapefruit, things like that. And I always tell everyone, everything in moderation. I am not here to take away fun and enjoyment. Alcohol's not on there, but that's one of them. But but everything in moderation. And you can dilute these bladder irritants by drinking water. So I usually tell, the residents that I'm working with, if you like to have a glass of wine when you go to dinner, have your glass of wine, just make sure that you drink 8 ounces of water after. And that way you're diluting the irritant and it will not have as bad of an effect.
Pure cranberry juice.
So that should be okay. And cranberry is a big one because it's helpful for the urinary tract. The problem is that most people don't drink pure cranberry juice. They drink the sugary juice. Cocktail. There you go.
Green tea is an irritant?
Yeah, so green tea is naturally caffeinated. There's caffeine in the green tea, so that'll play a role. But again, green tea has a lot of benefits, so I tell people, drink your green tea. Just make sure you're not having green tea at night after a day of orange juice, wine, sodas, and everything else, right? So everything in moderation. Decaffeinated tea and coffee are okay. Obviously, water is ideal. Yes.
Some teas are decaffeinated.
Yes, correct. So decaffeinated tea, decaffeinated coffee, all acceptable. I'm pretty sure there's decaffeinated green tea you can find.
Yes. There are teas that don't have caffeine in it.
Correct. Yep. So they're no fun. Right.
What's the purpose of it?
I like the taste, of coffee, so I will opt for decaf a lot of times. What was that one? No, it wasn't an appropriate comment, huh?
No, I would never say that.
Well, that's okay. We're all friends here.
A little humor is good for the soul.
I have to put jokes in here. I got to keep it light. All right, all types of diluted fruit juices, non-acidic fruit drinks, fresh drinks, herbal teas. So that goes to your point. A lot of herbal teas are going to be decaffeinated. And I don't know what this is, but it's on here. Red bush tea. If anybody knows what that is, let me know. I've never heard of it.
Is it possible to get a copy of that slide?
You can come see me, and I have a bunch of handouts for you.
Oh, okay. Oh, good.
I do like this one, though. I don't have access to a color printer. So this one's prettier. Mine's black and white. Additional bladder irritants include alcoholic beverages, tomato, that's the acidic, tomato products, and highly spicy foods. A common issue impacting urgency and frequency is the consumption of bladder irritants. One of the things that we'll do early on when residents come see me is do a log. A lot of times out of habit, people don't realize the correlation. They just kind of go about it. Nobody really thinks about when they're going to the bathroom and if there's some sort of routine to it. But I like to get a 24-hour log. Did you wake up last night? Write down when you woke up, when's the last time that you had something to drink, what is the last thing that you drank, and kind of going through all of that. So keeping a log will kind of bring insight and awareness to what you're doing and how that might be impacting leaking. Some people are like, I don't know, some days I have a really good day and then another day I have a really bad day. And when I hear that, I'm automatically thinking, what did you eat? What did you drink? And what were you doing differently on those days? So these are some substitutions. It kind of went over it in the prettier slide before. So coffee instead of regular coffee, decaf, low acid instant coffee, kava. I also don't know what that is. I'm assuming some sort of coffee product. Acidic fruits, citrus, alternatives are pears, apricots, papaya, watermelon, blueberries. Tea, alternative would be decaf or herbal teas. Soda and alcohol. I don't think it's nice to put the alternative water next to fun things like soda and alcohol, but there's other things. I talk to people a lot about, additives. Some people, I remember having friends growing up, I've always liked the taste of water, which has no taste, but I've never minded that. I had friends that hated the taste of water. From a very young age, they're like, ugh, can't stand it. Ugh, they didn't drink it. Now they have all these cool little things that you can add to your water to get flavor.
What was the advantage of those? Because I've got family members that just, that's all they, and I think that they're getting chemicals.
Yes. So if you like water, water is the better alternative. So I carry this giant thing around with me. I also, this is not plain water, not because I don't like the taste of water, but a lot of these powders and additives are for increased electrolytes. So I have to have more electrolytes into my diet. So I buy a powder that I look at the ingredients. I make sure it has the least amount of fake stuff. So I find one that has either real cane sugar, stevia, some of the healthier alternatives. So I am paying very close attention to what is in there, because you're absolutely right. 9 out of 10 of them probably have the bad aspartame, all those chemicals that you don't really want to ingest frequently. So being aware, right? And I'll usually go over that if that's something that is preventing you from drinking water, is wanting to have something that has taste. That's something that we'll, go over. Because there's more and more coming out, but there are differences in ingredients. So we'll, talk about that.
I have water with my bourbon. Does that help?
A water, yes. So a water, chasing it with water is,
Mixing
oh,
together.
well,
Bourbon water.
sure, you're getting water with your bourbon and diluting it at the same time. So good job.
1 shot of bourbon and a quart of water.
What's it called? A water back? That's what they call it.
Okay, well, I feel so much better now.
I'm glad I could make you feel
My
better.
socks still get wet.
All right. Okay. This is another common thing that I get from residents. Have you ever reduced the amount of fluid that you're drinking, especially water, because of the concern about having to go to the bathroom? Anyone here done that? Yes.
Did they have research? I was a teacher, and we were notorious for having bladder issues.
I have talked to a lot of teachers, and they'll say, listen, I could not go to the bathroom, so I just held my bladder throughout the whole day for 8 hours, and that's it.
Because you didn't want it.
Right. So when you were teachers and younger, you didn't realize the impact of that, and then that is a habit and a routine that you just got into because through your working career, that's what you did. Dehydration, which impacts you a lot more as you age, and you're a lot easier to get dehydrated as you age. Dehydration will cause bladder spasms. So a lot of people that tell me, well, I'm not going to drink water because it's just going to make me have to go more. And I say, well, not drinking water, you might not have a lot in your bladder, but your bladder is still going to spasm. Then you're going to go to the bathroom and you're going to have like a couple drips of water or urine. So what are you really, improving? So water is healthy to drink. Obviously, you don't want to over drink water, but the amount of water most of the residents admit to drinking, I don't think we'll have an over hydrating problem here at LVE. So water is very important. I like all the, she wasn't very positive in the last slide, but this guy looks happy. He's happy. All right. Many people with bladder problems reduce the amount of liquid that they consume, hoping to urinate less often. However, reducing your liquid can cause concentrated urine and is more irritating to the bladder lining, which increases symptoms. Signs of concentrated urine include deep yellow urine, urine with a strong odor, and or getting an urge to urinate, but only urinating a small amount. Be aware that some food and medications can also turn your urine dark and stinky. Most doctors that prescribe medicines, they don't always talk about side effects, but that is one that they will probably tell you because they don't want you to be alarmed. I know like neon is a big one with some of the medications, an orange type color. Some medications will turn the urine that color. So outside of that, if your urine is, that's usually how I can tell I didn't have enough water. If like my urine smells stronger, if I can even smell it at all, or it has a color, like a darker color, it should be very, pale, is how you know that you're well hydrated. Sometimes I drink so much water, I pee and I was like, I don't even see a color. It just matches the toilet color. So that's how I know I'm very, very hydrated. All right, recommendation is that you drink 6 to 8 glasses of water. That's 8-ounce glasses of water a day. You'll see some other things that will associate it with your weight. Drinking half of your weight in ounces. That's a hard call for some people. So
Sure is.
6 to 8 sounds better than 64 ounces. That sounds very intimidating and overwhelming. So again, you want to titrate that. So that's another thing that we'll do. I don't want you admitting to me, look, I really don't drink water, maybe 1 glass a day when I take my medicines and before bed, but that's it. I'm not going to say, well, by next week, I want you drinking 8 glasses of water a day. It will shock your system. So like everything else, you have to ease into that. Your body has been used to only drinking this much water. We've got to ease your body into increasing that. So maybe every week saying, hey, increase by 1 glass today. And then by the end, I'm going to say, hey, let's get you a fun water bottle that's big and says, you can do it. Way to go. They have really fun water bottles. Water is also very important in decreasing issues of constipation, which can cause increased pressure on the pelvic floor from bearing down during toileting activities. If you find that you're not actually urinating very much when you go to the bathroom, it could be that you are not drinking enough water. Oh, fancy. Okay, what you can do right away. Monitor your urinary patterns. Each void should take 5 to 10 seconds. If less than this, you may be going too frequently or training your bladder to do so. Another big thing is residents saying, oh, if I know that I'm about to go out of the house, I might have just gone to the bathroom, but I'm like, ooh, I need to stop and go to the bathroom just in case. No. Everything in your body learns, right? These are all learned things, learned breathing patterns, movement patterns. You don't just wake up with poor posture one day. That is a result of patterns and routines. Same thing with your bladder. So like the retired teachers are like, well, I don't go to the bathroom, I don't drink water because I didn't for 20 years. I didn't drink water and I didn't go to the bathroom for 8 hours. Your bladder learns and can be retrained. So we don't want to train your bladder to go when it doesn't have to go. That's just increasing the amount of time. So if there was 30 minutes between you actually had to go to the bathroom and then you were about to leave your house, that's telling your bladder, oh, well, I guess she wants to go every 30 minutes. And I don't think anybody here wants to go to the bathroom every 30 minutes. Keeping a log of how many times you void, how long you void, how many accidents you have. That way, when you see a therapist, this information is very helpful in determining what strategies would be most effective for you. That is, again, one of the first things that I do. I have a handout, and I have all the residents fill it out in one of our first sessions so that it can help both the resident and myself be aware and understand what might be causing some of these issues. Again, voiding 5 to 10 seconds. You want to make sure that you're not, if you're voiding for a very long period of time, then maybe you didn't finish from your last void. Or maybe you're not getting the signals sent frequently. So all of that, counts towards unveiling the mystery of urinary incontinence. So a couple of strategies: be aware of the bladder irritants, which are all the things that we talked about, especially what you're drinking in the evening, drinking more water and less caffeine and soda. Some medical conditions, heart failure is one of them. You are on fluid restrictions. So these are all things that we have to take into consideration, because if you're on fluid restrictions because of a medical condition, then these rules are going to be very different for you. So making sure that if you're on fluid restrictions, that we can guide and teach you how to find the appropriate amount of water. and making sure that your doctor's okay with the amount of water that you're drinking. Breathing and relaxation techniques to help you void more fully. So I briefly touched on this earlier. Positioning has everything to do with it. A lot of times, if you're on the toilet and even just sitting wrong in the wrong position, it puts a kink right there for bowel movements and urine. A lot of people, because of the ever so popular squatty potty, are more aware of this now, but the position, most people are at 90-90 depending on your height and how high your toilet seat is, but your legs are, kind of either straight out and down or, slanted a little bit if you're short. The ideal position is going to have you with your knee higher than your hip. So they call it a squatty potty because essentially it lifts up your legs so you're in more of this position. Going to the bathroom. This is what I get for doing demonstrations. I can't be trusted with a microphone. I'm glad. Is John here? I don't want him to see me breaking his things. So squatty potty is something that's really popular. I tell people you don't have to buy a fancy squatty potty. If you have a stool, it will do. Putting your legs up, it helps release the tension on the sphincter, and you'll go to the bathroom easier. So same thing with voiding, okay? I'll usually tell people if you think that you're done going to the bathroom, but you stand up and you've got dribbling going on, you're not done going to the bathroom. So make sure you sit there, relax, do some deep breathing, maybe change the position that you're in, and you'll probably release some more urine before you get up. And staying active. Exercise and activities help keep your muscles, including the pelvic floor, strong and help you sleep better. If you have the appropriate amount of lower body strength, core strength, all of those things, they're all going to play a role in how much work you're doing, right? If you have the proper body mechanics and you're going to pick up something that's heavy and you have good quad strength and you lift that up, you're going to bear down less because your muscles are working as they should and they're strong enough to do so. If you're picking up something that you should not be picking up and you're using poor body mechanics, you're doing things like this. And you're picking up, you're compressing your diaphragm, you're bearing down, you cannot breathe, and you're bearing down on that pelvic floor. And you either will have some stress incontinence happen or you're putting yourself at risk for that to be the case in the future because you're putting unnecessary strain on those muscles that already have a very big job. They have to hold up all your organs. They're tired. All right. That's out of order for mine. Well, I'll write it up there. Okay. Therapy and resident partnership. Together, we can get great results. Most insurances cover pelvic rehab, and your privacy and dignity is important to us. Sherry, these slides are wrong. They did skip ahead. Let me make sure I covered everything here. All right. This one talks about me, so I'm going to say it. Your therapists here at LVE have specialized training in pelvic health. With an order from your physician, I can complete a comprehensive evaluation of your symptoms and needs and provide an individualized treatment program designed just for you. These programs generally include training your bladder and/or pelvic floor as needed, recommending lifestyle changes if needed, and developing an exercise program to keep your whole body working right so that you can go out and enjoy your friends and family. All right, preventing leaks is a therapy and resident partnership. Together we can produce very encouraging results. Sherry back there, not me. I don't do this part. I don't like insurance. She'll verify your insurance and let you know the details of your coverage. Your privacy and dignity is very important, and all information is kept confidential. Evaluations and treatments can be provided wherever you're most comfortable. We have a new private treatment room in our rehab gym, or if you prefer, I am more than happy to come work with you in the safety and comfort of your own home. Take a stand against leaks. You can have a dry future. He's happy. That man looked happy. All right. Thank you for joining us today. We're committed to providing you with the highest quality of life possible. You should not just accept urinary leakage or incontinence as an inevitable part of getting older. Let us help you control your pelvic health. And then our phone number is there. I can always write it. There's some handouts in the back. Is our phone number on there? Yes. And it has our phone number on that handout. Anybody have questions, concerns, comments?
Can drinking more water train your bladder to tolerate?
Yes. So easing into drinking more water, right? So that's when I
Tolerate it longer and more efficient.
so it'll allow, your bladder to increase, but you can't just drink water to train your bladder to not go to the bathroom more. By drinking more water, you're going to cause it to spasm less, not have the irritant that causes it to spasm. So that is one part of it. But if you have a pelvic floor dysfunction, do you want to hand her handout before she goes? If you have a pelvic floor dysfunction, then that's a two-sided problem. The intake of water is something that can help, right, improve pelvic floor function, but if you already have weak pelvic floor muscles or tight pelvic floor muscles, then you're still going to have an issue with leaking, possibly.
So to confirm what to do next, if we feel like we can take advantage, the first thing we've got to do is contact our physician to get, so even before we call you, we would get the prescription from the doctor.
Correct.
To say, I think I need this. Is that,
Mhm.
do they,
Yeah, there's a lot of diagnoses that can lead to incontinence, even just having weakness, again, having, osteoarthritis, diabetes, there's a ton of diagnoses that people have that don't realize that can be an underlying factor in urinary incontinence. So if you go and you say, hey, I'm having some leaking of urine, and there's therapists at my community that provide pelvic health. Do you think you could write me a prescription for it?
yeah, okay.
Mm-hmm. Not just from Angeli. Angeli has obviously sent me a lot because that's a lot of people use her as their primary, but I have gotten from gynecologists all the way down in Atlanta sending scripts just because during that appointment, that's when it was brought up. But I've gotten a fair amount from some of the more common physicians around here, so it won't be something that
Do you
they...
tell them just to send the prescription
Mhm.
to your village, or is it to you?
So to the rehab, Sherry can probably answer that better than me.
Most of the doctors in the area already have our information, and they know the fax number and what have you. So, but if there's a question, just come to our office or call us, and we'll help you facilitate that.
Anyone else? Okay, well, Sherry's got some handouts for you that you can take on the way out, and it has some key takeaways and some instruction for if you are having this issue and you would like to get assessed by me, what you can do at the bottom there. And I thank you all so much for coming and spending a little bit of your afternoon with me. You're welcome.